we'll go ahead and pass it on to Ryan, who is representing Find Help, and we'll talk about LinkU.
Fantastic. Thank you so much for having me today. I appreciate the time. I know this is a packed agenda and a lot of other things to cover, so I do appreciate you giving me the first hour or so here. I'm going to go ahead and share slides in just another second, but I want to let you know beforehand, if you have questions during the course of the presentation, feel free to put them in the chat. I will be looking at that, kind of periodically. If you have any more detailed questions or you want to ask, with your voice as opposed to using the chat function, I just ask that you wait until roughly the last 15 minutes of the training and we can open it up for discussion then. I'm also going to be sending a couple of links in the chat as well to both your LinkU sites and our support portal and a few other resources. So just keep an eye on that. I would definitely recommend bookmarking any of those links that I send over. Quick introduction for myself. I am Ryan Thieck. I'm a customer success manager with Find Help, and I've been supporting DC in their use of the platform for about 2 years now. Now, essentially, LinkU is a community resource portal. Sorry, hold on, here we go. So it's a community resource portal that is intended for anybody in the greater DC area. So even if you're in Maryland or you're Virginia or one of those surrounding neighborhoods, that is totally okay. You don't have to be in DC proper to use this. And essentially what it does is it gives folks a direct access link to different CBOs or community-based organizations and other nonprofits and social service providers that you can then connect your clients to in the event when they need support with food, housing, transportation, behavioral health resources, and things like that. Now, Find Help is the company that supports this platform from a technology perspective, as well as all of the data that is included there. And our mission here at Find Help is to help connect all people in need with the programs that serve them with dignity and ease. Everything that goes through this site is HIPAA compliant and high trust certified. So if you're ever sending a referral for a client and you need to keep track of not only their name and their contact information, but other health records, IDs, MRNs, and things like that, just know that all of that data is securely kept, and it's behind multiple firewalls, and I don't even have access to it. It's purely for folks on your side to use and report out on. And if you have any questions about our security and data compliance processes, just feel free to let me know. So just a little bit more about Find Help. We've been in the business for over a decade now, originally founded out of Austin, Texas. We've now explored the entire country from coast to coast. We support folks in every single one of the 50 states here, and we recently surpassed 25 million users in total, which is great. We're continuing to see that number go up and up. And the way it essentially works is that you have 2 different websites. So there's a staff site and a community site, and I'm going to send you the link for both of those right now. First, I'm going to put the community site link in the chat, which goes by linkudmv.org. And then you also have what we refer to as a staff-facing site. So for everyone that's on the call today, you would use that second link that I just put in the chat, which is staff.linkudmv.org. The main difference between these 2 environments, it actually has nothing to do with the programs that are listed, and it has very little to do with the UI either. They are essentially the exact same website, but the main difference has to do with what level of data you have access to and how you can then pull that information out for reporting after you've sent a referral or closed the loop on that communication. So the community site, which is again linkudmv.org, is what you would send to any clients so that they can self-navigate, right? So you have a conversation with somebody, maybe you've identified a few needs that they need to address, and they want to do some research on their own behalf, which is great. We want to enable people to really take control of their own lives in that way. You would send them the community site link. The reason being is that you do not have to log into it. It doesn't require you to put in an email and a phone number and a name. You can use it totally anonymously. The difference is that any of the referrals that are sent through the community site, you won't have that in-depth reporting access from it, right? The intention here is that folks can send themselves to a program or a close, family member or a friend, and because they're not technically going through all of the consent agreements and signing all the paperwork and things like that, you won't have access to all of that detailed referral information. However, if you use the staff site, which is again the one that you will be using, any referral that you're sending on behalf of a client, you now have access to report out on that going forward, right? So if you're taking track of their name and their email and maybe a couple of comments here and there regarding their situation at home or at work or the behavioral health that they're undergoing, you have access to that data. And not only will you have access to it, but other members of your team can view that information as well so that you can work collaboratively. Say, for example, I send a referral for a client today, and then I'm on vacation, on a beach somewhere, and that person calls back and they need to follow up on the status of the help that they're receiving. A team member of yours can then view that information once it was logged into the staff site. So that's the main difference. Otherwise, the data on the two sites in terms of what programs are listed is identical. The UI is exactly the same as well. So I've sent both of those links in the chat. I would recommend bookmarking both of them, but especially that staff-facing site, which is what we're going to talk about right now. So again, this one does require that you log into it. You have to log in. And the way that you would do that is by navigating to this page here. So the link that I provided in the chat will take you directly to this screen. If you don't already have an account, and if you do, you can just log in easily with your email and password. But if you don't have one, you just want to click sign up in the top right-hand corner. And then all you'll need to do is enter your work email address, not your personal, but your work email address, first name and last name, and then set a password. You do not have to put in a username. It says optional. If you leave it blank, it'll just use your email address, which frankly is probably even better from a reporting standpoint. But if you want to use a username, you can add that in. And then otherwise, make sure that you click this button here once you've had a chance to review the privacy policy and our general terms. And then lastly, very important, you want to select the button that says, I'm searching to help other people, as opposed to I'm searching for me or my family. If you do want to create a personal account, you very much can do that, but we would recommend that you use the community site for that purpose, and you use a personal email address as well. Again, on the community site, you do not have to create an account. You can use it anonymously. But if you want to keep a little bit more information based on the referrals you're sending for yourself, then you can do that here. But again, for today's purposes, we'll be in that community site. Now is actually a quick chance where I want to pause and ask. I believe I saw Nora on the call. Nora, just want to double check with you. For a lot of the folks on the call here today, have you already invited them to create an account by adding them to that backend group, or is this something that we should go through right now together?
We have not added those in attendance on the staff site yet.
Okay, so now's probably a good chance for folks to take just 2 or 3 minutes to do that now. So again, please go to that staff.linkudmv.org link. And just as I mentioned before, name, email address, set a password, make sure to click the button that says I'm searching to help other people. That is going to indicate that you are using this in a staff capacity, and that you'll then have all of the different reporting privileges and other tools that are only provided to those of you with DC Health and your kind of partnered agencies. Otherwise, if you're using a personal account, you don't have access to those same tools. Any questions so far? You can put it in the chat or just ask me directly right now. All right, so I'm actually going to pause for about 60 seconds and just give folks an opportunity to create that account. You will receive an email to the email that you put in here with a link to verify it, basically the same way that most other websites work these days. When you create an account, it sends you an email, click the button to verify it, and then you're good to go. So I will give about a minute for folks to do that, and then we'll move on to the rest of the training.
Drop off duty.
All right, I'm going to start moving forward, but if you need another minute or two to just complete that account setup, you can certainly do that right now or after the call. Once that does happen, Nora, I believe, is going to be making sure that on the back end, folks are added to the necessary groups and reporting roles. So the way that typically works is we have a few different site administrators and group managers already configured in the back end. And one of their responsibilities is to make sure that all of the users on the staff site are assigned to those proper teams, which is what's going to enable you to not only get the in-depth reporting that you need, but also view information for referrals sent by other people if necessary, right? Again, that's part of that collaborative aspect here. Yeah, question, go ahead.
Hi, no, this is Leah. And for those of you, Ryan, if you can clarify for those of people on the call that are not at DC Health, so we have a bunch of community-based organizations here that are part of the collaborative. What you just explained about what Nora would be doing on her end, what do the CBOs need to do on their end? Or do they?
Yeah, so for any of the participating agencies here today, you can go ahead and create that staff site account, even though you are not technically like a DC Health employee. That is totally okay. Maybe, Leah, I might want to follow up with you and Nora in an email after the call today, just to make sure that we have the backend groups configured properly for these folks. And I can loop in Colton to that discussion as well, as he is our community engagement manager. I won't explain that too much depth for everyone here today, just for the sake of time, but I think Leah and Nora, you've both met him already, right?
Yeah.
Yes.
Okay, so I will check in with you both about that later today. But it doesn't change the process right now. Just go ahead and create that account and we'll make sure that you're set up properly in the back end afterwards.
Okay, thank you.
Yeah, of course. All right, a couple of terms and then we'll actually jump into the live demo. Find help, we talked about that already. A seeker is the word that we use to describe any individual seeking services. So client is another word that you might use in that case. A program, as we refer to it, is any free or reduced cost social service that we list on our platform. And then community organizations or community-based organizations or CBOs, that would be many of you, so you know what that is. Now into the actual demo. I am going to be using our demo platform for this, or at least for parts of it, so I will make it very clear as to which site I'm in at any given time. Let's start with the community site, though, just to give you a sense of how this is going to work. Again, if you're logged into the staff site, the UI and the workflow is essentially the same as what we're going to be showing you here. So you want to start any search with a zip code. I'll use 200005 for now, but you could plug in any zip code in the country and it'll work. From that, you're going to find a list of categories at the top of your screen for things like food, housing, goods, transportation, financial assistance, and more. And each of these categories has subcategories and subcategories in some cases. You don't have to go through and read every single one of these, but if you are interested to learn, okay, what types of financial assistance programs do we have? Well, there's help paying for childcare, help navigating government benefits, disability benefits, help paying for school and supplies and things like that. Again, there's a lot of different programs that we cover here, so I won't read through every category, but this is a really helpful way to navigate the system if you don't know exactly what you're looking for. If you do know what you're looking for and you can be very specific, then we encourage you to use the search box in the top left-hand side of your screen. So you could easily type in food pantry, maybe, behavioral health, maybe bus passes, other kind of transportation resources, whatever it is, you can enter it there and you'll start to find those programs. Or alternatively, you can use one of our categories here. Another thing to note before we get into a lot of detail is just in terms of making sure that this platform is accessible for everyone. The entire website can be translated into over 100 different languages. So in the top left-hand side of your screen, right underneath that search box, you can click the button here and then select any one of these languages and it'll translate into it just like that. And you can always jump back into English or whatever other language you need just by using that same workflow. Okay, so once we're in the site, we're logged in, we've put in our zip code and we've put in some kind of search term or clicked on one of those categories, you're going to start to find programs appearing on your screen. Typically, we are going to filter them by what is closest to you and what seems most relevant. The way that we do that is by taking a few different things into account. So not only how close is this program to the zip code that you entered, but also we want to make sure that if we're looking for financial assistance, that this is a program that provides that, So we use these different tags here at the bottom where it says main services and serving tags to indicate what this program actually is providing and who they are providing it to, right? It might be specific to veterans, senior citizens, children and families, things like that. So all of those different tags here correlate to the different categories that we can search for, as well as the filters that we can apply, which is what I'm about to discuss, but I want to acknowledge the question in the chat. What platform is used for the website translation? Great question. Google Translate does all of it with the exception of Spanish. We have our own in-house translation that we believe is even more accurate than Google. Otherwise, it's all Google there. Speaking of Google, one thing I glossed over is this map that you see here in the top left-hand side. This is basically just Google Maps embedded in the site, with the only addition being that all of the programs that you see here are indicated with a red icon. So the one that I'm clicking on right now. So if you are visually oriented and you want to see, okay, what's a good option that's, on the way from downtown to, my office or wherever you might be looking, you can click on any one of these red icons and it'll tell you what that program is and where they're located. And if you click on the program name, it'll then bring you to more information about that specifically. You do not have to use this, but certainly helpful if you like to look at the maps and you know where everything is. Otherwise, let's start to talk about how we can filter these programs. Say, for example, here, we're looking at financial assistance. There's almost 650 programs in the area that provide some kind of financial services. That's a lot. We don't expect anybody to read through 600 programs. Most people don't even make it to the third page on a Google search. So usually 10 to 20 programs is what we would expect anyone to read through, especially given kind of the busy nature of our work. So what we want to do is make it easier for you to find the right program rather than just assuming that the first or the second one is going to be the best fit. So to do that, we offer a couple of different filters at the top of the screen. So you can click personal filters or program filters to indicate that our program needs to be open on the weekends. They need to have a phone number listed. Typically, programs will have a phone number and an email, but maybe it's just one or the other. So if you have to call or you have to email, you can indicate that here. You can also say exactly how far you are willing to travel. So if you want to go visit in person, you say, I want to visit this program. And then you can say, needs to be within 5 miles or 15 miles, or you can even set a custom radius, let's say 10 miles. Only programs that are open on the weekend. Let's go ahead and filter that and see if we go down a little bit. So we started with 640 some programs, and after a quick filter, we cut that number in half. That's pretty good, but I think we can do better. So let's look at the personal filters here. This is where you indicate some of the aspects of the seeker or the client that you are helping connect to services. So for example, what age group are they in? Are they an active duty, National Guard, or veteran? What is their citizenship status? Are there particular disabilities or chronic conditions that they're dealing with? I'm not going to read through every single category here, but again, just check off a few of these boxes as necessary, and then you can filter programs even further to find something that's really, really relevant. So for example, let's say it's a senior citizen who is a veteran. Maybe they have limited mobility and are underinsured, just for example. So we'll click a few of those boxes and filter our search. And we're going to see that number of available programs go down even further, which is a good sign, right? We've gone from 600 down to 117. That's pretty good. We could go a little bit further if you want to, using our income eligibility filter. This one is not always relevant because a lot of programs that we provide are free and income is not a qualifying factor for those. But in some cases, you need to be making under a certain amount. That's something that we can easily calculate. Here, you would just want to indicate the number of family members living in that household, and then how much that entire household brings in per month, typically after taxes, right? So let's say it's a family of 4, and they bring in, let's say, $3,000 per month. You could filter that as well to indicate if any programs they wouldn't be eligible for because they're making too much, then we don't show you those programs because it's not relevant. It's just going to take up too much time for you to have to read through that, and we want to kind of get you on your way and make sure that seekers are getting connected as quickly as possible. So those are the 3 types of filters. You can change and mix and match, in any number of permutations. If you add a couple filters and then decide, actually, they don't need to go on the weekend, they can make some time work during a Monday to Friday. You can always just uncheck one of those boxes or maybe clear all of the filters if you want to go back to a more general search, or you can add more filters. Again, this is pretty customizable in terms of how you want to use it. But once you've done all that, hopefully we're down to a smaller number of programs. I know we still have over 100 here, but that's better than 600. And again, our search algorithm is going to take a few things into consideration and show you the ones that we think might be the most relevant, the closest to you. And we're also going to take into account whether or not the program is a claimed resource, is it a featured program, a few other things that we can do on the back end just to highlight and boost some of our close partners that we know really work well within the system and are frequently responding to referrals and taking good care of our, our communities here. Now is where I'm actually going to jump into the demo site. So again, this has been on your community platform, the LinkU DMV. This is exactly how it would look in your staff site as well, but I don't have an account on your staff site, so that's not something I can access. So now we're going to go towards our demo site. So again, same processes, same search and referral process, but now I'm going to be able to show you in a little bit more detail because I can send a test referral without it actually going to any programs. So let's say here we're looking at a couple of food pantries in the area. Now, when you see the programs, they're all going to be organized in the exact same way. So let's talk about what that information is and how you can find it. The first thing you're going to see is the name of the program, and then followed by that, you will see the name of the provider. So what is the larger organization, governing body, or faith-based organization or nonprofit that is actually providing this service? It's important to call this out because in some cases, you might have an organization that provides a number of programs. And if you're helping a seeker that has a food and a housing and a transportation need, it might be easier to kind of keep them in network in a sense by finding a few different programs that are offered by, let's say, the same local church, for example. So if you click on that provider name, it'll take you to a separate page. It says, here are all the programs provided by this institution, and then you can scroll through and see all of them, which again, might be really helpful in the instance where someone needs to be connected to multiple needs. So you have the name of the program, you have the name of the provider. Underneath that, it'll tell you when this listing was most recently reviewed. Data accuracy is extremely important to everything that we do at Find Help. And for that reason, we actually have a dedicated data curation team that spends their time routinely reviewing these programs. And they also add new programs as we find them. But one of their core responsibilities is to make sure that every couple of months or so, they are going back to all of the listings. And we have about 500,000 of them over the course of the country. And they can actually see, okay, it's been a few months. Let's make sure that the phone number is still accurate. Let's check that address. Let's make sure that they're still open at the same time that they said they are. So just checking all the office hours and all the other contact information. So you will see here, this program was last reviewed on June 8th. This one also June 8th, June 15th over here. That's today, actually. That's pretty good. So it'll indicate how recently this was reviewed. Even if it was a few months ago, I wouldn't be too worried. If it was past 6 months, that might indicate that maybe another Google is in order just to make sure that everything is in line, but you'll almost never find that it was reviewed less recently than about 6 months ago. That's the benchmark that we try to hit internally. More often than not, it'll be within the last couple of months. Underneath that, you will have your description of services, just basic couple of sentences. What is this program providing? What can you get as a seeker, as one of your clients that is in need of services here? To the right-hand side, you're going to see your contact information. This can look like a couple different things. You might have a phone number. You'll typically have an address. You'll probably see office hours as well. So sometimes they're only open one day out of the week, especially when it comes to food pantries. This one's only open on Wednesdays. This one's only on Tuesdays. And it'll understand what time of day it is right now and what day of the week it is right now when you're looking at it. So it can tell you very simply, it's closed today, but check the hours, maybe it's open tomorrow, right? So if you were to be navigating to this on Wednesday, sometime in the afternoon, it would say that they are currently open. So it's going to take your time of day into account. Assuming that you're kind of on the East Coast, it's going to correlate perfectly there. So you have all of that contact information on the right-hand side. You have your basic description here. If you click more info on the bottom left-hand side, you will find a lot of other information about the program, including their eligibility criteria. How available are they? In some cases, a program might actually tell you exactly how many slots they have open. Let's say it's a temporary shelter and they only have so many beds. they'll tell you, okay, we have 8 beds available as of right now. And that's something that they can update over time. They don't have to rely on Find Help to do that for them if they are a claimed program, which is something I'll talk about in a few minutes. Other information that you'll find down here includes the languages that the organization operates in. So English is usually included there, but sometimes they also have Spanish-speaking staff, French-speaking staff, whatever it might be. If they have someone on hand that can communicate with the seeker in a language outside of English, they will list it here. That way, you can send them somewhere where they can have that open conversation and be honest about their situation without having to translate in their own heads. You'll have website links, social media links as well, Facebook, Twitter, LinkedIn, whatever it is they want to include here. It'll tell you what area the program covers. This is especially important for all of you because DC is such an interesting, political and geographic part of the US. It's kind of a state. It's not totally a state. So in a lot of cases, you might find a program that is just over the river in Maryland, but they actually do not allow DC residents to get that service because it's maybe offered by the state of Maryland, let's say their Department of Veteran Affairs, right? So this coverage area listed here will indicate, okay, this program only covers folks in DC, or it covers Virginia and Maryland as well. Now you can trust that if it shows up in a search based on the zip code you entered, that it's going to be covered in that zip code, right? So it's only when we're kind of on the margins there and we want to be double, triple sure that you can check that coverage area because it'll tell you exactly what area they're covering, which is important because you don't want someone to be sent away because they actually live in Virginia and they need to be in DC, something like that. Lastly, it'll just give you all of the office locations. If they have multiple locations, it'll list all of them here, but the closest one is what you will see on that top right-hand side. It's a lot of information, and we're roughly the halfway point. So the next half of this hour is going to be focused on sending referrals and then following up on those referrals and viewing all of the reports as needed. So before I go into that, just want to pause quickly for any questions. And you could use the chat or you could unmute and just ask me directly. All right, I think we'll keep it moving then. So before we jump into the referral process, there's one other thing I need to mention. You have a recently revamped and updated standard needs assessment, which you will find right on the landing page. So when you log into your staff site, again, this is your community site here, you will see a button at the top of the screen that should say something along the lines of standard needs assessment, right? Again, on the community site, there's a community needs assessment. Anybody can fill this out. It's a great way for them to keep track of their living situation, their financial situation. Are they food insecure, housing insecure, all of those things. So you have a version of this assessment that you can complete. Once you're logged into the staff site, you will see it there at the top. And it looks a little bit like this. This is from our QA environment, but it's almost an exact carbon copy here. This is something that you can complete with the client. If you're there in person with them or you have them over the phone, we really recommend that you take about 10 minutes to go through this, because in addition to just keeping track of their basic information, their name, gender, sexual orientation, all those other demographics, it'll ask you some very specific questions about their living situation, what is the state of their housing, their utility payments, do they need support with things like that? From a food perspective, how often are they worried about running out of food or not having the right kind of nutrition for themselves or their families? There's a lot of questions here. We go over financial support, medical needs, mental health, transportation, et cetera. And if you fill out all of these answers and then submit the assessment, it will actually take you to a curated list of programs so that you don't even have to do the entire search yourself. So in other words, there's 2 workflows. One is that you just drop in a zip code, say I'm looking for a food pantry or for behavioral health services, and then you can filter and find the program that you need in the same way that I just showed in the last 10 minutes. Alternatively, if you fill out that assessment, once you submit the assessment, it will show you, hey, based on all of the responses, it sounds like this person might need some, substance abuse support. Here are some programs that are a good fit for that. Or maybe based on the responses, it seems like they have their finances okay, they have their living situation, but their transportation is a little bit, unreliable. They don't have a car, they're waiting on the bus or the train, and sometimes it doesn't work out for them. Here are some programs that help them maybe finance a vehicle for themselves or bus passes, provided by the state, something like that. So again, it's not required, but if you have the time, we strongly encourage that you go through this assessment process. Not only will it tell you, here are the programs that are a good fit, and it basically does the search for you, it'll also save all of those answers in the seeker's profile in FindHelp, which is something I'll show you in about 10 minutes. Basically, it's your way of saying, here's all of the referrals I've sent for this person, here's their completed assessments. We can update it over time. We can export it if we want to throw it into a Google Drive or some other document repository. It's all available if you complete the questionnaire here. This is also something that can be updated over time. So this is a recently updated version that I was working very closely with Ashley Coleman and a few other folks from the DC side on. So if there are other needs that we need to address, other questions that should be asked, just bring it up to your team lead or your supervisor. They can get in touch with me and we can always change this as necessary. All right, time to talk about referrals. So this is probably the most important part of today's training. The way it works is when you are viewing the programs, you're going to have a couple of different options in the bottom right-hand corner. It might say refer or contact here. It might say apply here. It might say contact on their website, or in some cases, it'll say see next steps. Whatever it says, just know that this button in the bottom right-hand corner is your referral mechanism, right? So the only reason that it changes is that it depends on the actual service provider, because in some cases, they want you to call them because they have an entire, phone dedicated to that. And they have, a suite of people in a room, answering the phone and getting people connected to services. And they want all of the referrals to be ingested in that manner. In some cases, they have a website and a scheduling system that they want you to go through. And in some other cases, they're okay just receiving an email with all of the details. So because there are different contact methods, we make sure that we give organizations the ability to say how they would prefer to receive referrals, right? So for example, we might have a program where we have a phone number and an email address on file and their website. And we ask them, hey, which of these three methods is best for you, right? Do we want you to call or email or text or go to your website? And they'll say, actually, go to our website. We've already built out the process. That way it automatically saves that invite to, our case manager's calendar or something like that, in which case that's exactly what you should do. So by following the steps in this button on the bottom right-hand side, you will know the intended workflow that you should use to connect to that specific resource. And again, it's usually just one of three things: phone call, email, or going to their website. So let's go through each of those examples. If they have a website that they want you to connect through, it'll probably give you the link to that website. You can follow that link. This is our demo site, so don't worry, it will actually take you somewhere usually. And it'll bring you directly to the page where you can then fill out a form, schedule some time, and kind of go about the referral that way. If they want you to call them, it might say see next steps, and then it says, hey, here's the best way to connect. Call this number to get more info. It also might indicate that you can go directly to them in person. Where is the nearest location? Let's pull that up and have a quick chat with them in person. That's totally okay as well. If the program is comfortable receiving email-based referrals, which is our intended method, but of course, there's a lot of different ways we can do this. But if they are able to receive email-based referrals, then you will see a button that either says refer or contact here, or in some cases apply. I'll explain the difference. But what you will find immediately after clicking that button is that there is a web form that you can fill out. So when you're logged in, and do make sure that you're logged in, you'll know by seeing your name up in the top right-hand corner here. You'll want to click that button that says refer. You want to click here to indicate that you are referring someone else, not yourself or a close family member. And here is where you actually start to fill out information about the seeker. So you can start to type in their name, and maybe you'll find that they've already gone through the LinkU platform. If so, you don't have to double document all of their contact info, right? So if, let's say, I sent a referral for somebody today, and then a week from now, Nora needs to send a referral for that individual, just by plugging in their first and last name, she can autofill the contact information, so she doesn't have to just double document all of those things. It's another way to save you time. If they've never gone through the system before, excuse me, then all you need to do is just fill out their information manually. So, test first name and last name. What is their email address, phone number? You don't need both of them, just one of those fields, either email address or phone number is required. You do want to indicate their primary language. That's just something that we want to keep in our records so that when you're having a follow-up conversation, whether or not they need to be connected to a translator or something like that. Skip patient ID and Medicaid ID. I don't think these show up in your environment. Again, this is our demo platform, so you won't see those here. But what is important is that you indicate what is the best way for the program to contact the seeker, right? The person that we're helping. So you want to ask that person, okay, we have your email and we have your phone number on file. What would you prefer, right? If someone asks me, I tell them, do not call me because it's probably a robocall and I won't pick it up if it's an unknown number. So I would tell them, text me or send me an email. You might have someone that says that they never check their email and they would rather you call them or maybe send them a text message, or maybe all three of them is fine. It's totally okay. Just ask for their preference and select that here. There is an option to select don't reach out. The reason why we include this here is we are very aware of the fact that in your line of work, you may be talking to somebody that is in a bit of a sensitive situation with regards to their safety and privacy, right? Say, for example, you are talking to somebody who is suffering from domestic abuse. If they share a phone number, a landline, let's say, with their abuser, it would not be beneficial if a women's shelter called that number and left a voicemail saying, hey, we confirmed your appointment. Let's get you some help, right? If the abuser hears that, that could be a dangerous situation. Similarly, let's say we are assisting someone that is going through substance abuse counseling, and maybe their, partner or their parent or somebody is checking their email address and they want to keep it private and they don't want people to know that they are going to a methadone clinic or something like that. Again, that's another really strong reason to select don't reach out. What this does is it actually tells the program at the point of referral, hey, here's the information for this individual, but do not call them. They will come to you, right? We make it very clear just so that everyone is on the same page that if I've been connected to a service, but I don't want them to call or text or email me, then they won't do that. I will go to their office or I will call them and we can kickstart the work that way. They will not contact me first, right? So usually you won't have to select that button, but just keep it in mind based on the situation, use your best judgment. You are all experts in this space. I'm sure these are conversations you've had in the past. So do know that that is an option, and we make it very, very important because we want to protect people's transparency or their privacy, I should say. Lastly, just throw in a comment. You don't have to do it, but I recommend just typing a sentence or two just to indicate a little bit of detail about what is actually happening here. Especially if we're referring someone to a food pantry and they have dietary restrictions, they're gluten-free, they're lactose intolerant, whatever it might be, you can indicate that here. That will be sent in the email to the program so they have all of the details that they need. Once you've gone through those steps, and again, this can take as quickly as like 30 seconds if you have someone's name on file, it just autofills that information. You say, okay, they want an email. Type a sentence indicating what's going on, and then just make sure that you have their consent to electronically share this information. So it'll say here that you have appropriate consent from the person that you're helping or their guardian, if they're under 18, to send their contact information, additional info through the system to this agency, and that the agency can contact them back. So look what happens here in the consent agreement if I select don't reach out. Right now, the consent agreement has removed the portion where we are consenting that the program can contact the seeker, right? Because we've selected don't reach out. If we unselect it, then now this will be re-included in the consent agreement. Very important to know that. We don't want anybody signing on to something that they didn't actually agree to. So if they said that they don't want to be contacted, you are not getting their consent to do that. We'll make it very clear here. And that way you can just keep everything above board and make sure that we're all on the same page. Once you fill all that out, you click the send button and the referral is out there in the world ready to go. So what does that actually look like? Let's take a look here. We have emails that we will send to the community organization that indicates who is sending the referral, that's you. Who are you sending the referral for? That's your client or your seeker. How do they get in contact with that person? Should they get in contact with that person? It'll include your comments as well. And that's basically it. So a version of this email will go out to the person that you're helping, and another version of that email will go directly to the community organization so that they can follow up accordingly. That is the referral. That is the communication being sent. And now they can connect the dots and start to help that person. Any questions so far? I know that's just one of the referral methods. So there's another one we're going to talk about in a moment, but I want to quickly pause here. Okay, just a couple more things to cover. So let's jump into it. The other type of referral is what we call a logged referral. So if you are going to the organization's website or you are calling them to get connected, that's great. You should go do that. But how do we get that information into LinkU, right? Because in addition to being a database of programs and a referral mechanism, this is also a reporting tool. And it's very, very important that you can use this as a consistent case management tool, meaning that all of the connections that you're sending are visible in one place. So if I pick up my phone and call this organization to place a referral and I hang up, that information doesn't automatically show up in LinkU, right? It's not scrubbing your phone records. So what we encourage is that once you've hung up the phone or once you've finished scheduling something on the website, the program's website, that is, you come back into LinkU and you click the button that says log a referral. This is essentially a carbon copy of that information for your records. And it says very clearly, this form is not sent to the program, right? We're not sending them an email because you've already called them. This is just your way of keeping track of that information that you already told them over the phone. That way you have a record of it in LinkU going forward. Can you go back and review how we go to a logged referral? Absolutely. So if you're viewing a program that says see next steps because you should call, or maybe it says that you should go to the company's website or visit them in person or anything like that, it'll say helping someone else, log a referral. You click that button and that's how you do this. Good question. I know I'm moving a little quickly here. So what you'll want to do is basically fill out the exact same things that we just talked about in the direct referral email form. So you say, I'm referring someone else, put in their information, contact info, add a comment, and that's it. You don't have to get consent because we're not electronically sending this to anybody and it's not facilitating any email communication. So you do not have to get consent to log a referral. Typically, before you pick up the phone and call an organization, you just want to ask the seeker there in person, just say, hey, is it okay if I call this food bank? They'll say yes or no, right? So that's not a consent that we need to track here in LinkU. You go through all those steps, you submit it, what actually happens? So the difference between a live referral versus a logged referral, one of them I already mentioned is that you won't see that consent agreement in the case of a logged referral. The other things to keep in mind is that when you submit a referral, an email-based one, the person you're helping gets an email and the community organization gets an email, and you have a record of it in LinkU. If you log a referral, meaning, again, you've already called them about this, the person that you're helping does get an email with the summary info, but the community organization does not receive an email because they've received it in a different way. You will still have a record of this in LinkU. Can I share the direct link? Yeah, of course. Just making sure what you're asking for here is the staff site for LinkU. Is that it? I just pasted that again. Yes. Okay, perfect. Yeah, that's the one that you would use to create an account and then go through all of these steps. Okay. So once a referral has been sent or logged, you're going to find that information by going into your People I'm Helping dashboard. This is the last step. I know we're at the 10-minute mark here. So when you're logged in, again, you'll know that you're logged in because you see your name in the top right-hand side. To the left of that, it'll say People I'm Helping. You click that button and then you click People, and you're going to see all of the folks that you have sent referrals for. You may also see some names that you didn't personally refer, but that a team member of yours did refer. Again, that's how we can all be collaborative and help each other and cover for each other if someone's out. So you can pull up someone's name just by clicking on it. You can search for them directly here if you want to. And if you open their profile, you will not only have their detailed information on the top left-hand side, so their basic contact info. If you completed the needs assessment that we talked about, this one here, the standard needs assessment, you'll have that completed assessment listed here under the form section, so you can view that at any time. If you have other documents that you want to upload to their profile, you can do that here. Let's say it's a veteran's ID, proof of income, anything else that they might need to present in order to be eligible for services. But most importantly, under the navigation history, you will see all of the referrals that have been sent for this individual, even if it was by a team member, right, that you're assigned to the same group as. So we can see that we referred them to a food pantry, housing support, another rehousing program. And in each of these referrals, it'll give you the kind of audit trail for when this happened. So I sent the referral back in January, and then later my colleague Michael set the status of the referral to Got Help, right? So this is something that multiple people can work on in tandem with each other, because we know that you are all helping the same people at a lot of the time. To your question, this section is under the People I'm Helping dashboard. So in the top right-hand side, click People I'm Helping and then People. And that'll bring you to this page here where you see all of those names. You can search for them, or you can filter by date of birth, who's assigned to that individual, a couple other things on the left-hand side. But again, very importantly, when you pull up their profile, you can see the status of the referrals. So in order to, sorry, let me go back to George. What's very important to keep in mind is once you've sent a referral, you want to follow up with that individual a little bit later, right? So maybe it's a week, maybe it's 2 weeks. You can set a follow-up date by clicking Edit Personal Info when you're on their profile. And then you can say, okay, let's set a follow-up date for next week sometime. Let's say June 22nd, and save that. This will mean that when you're on the list of people, you can filter by the follow-up date. So let's say you log in on Monday and say, okay, show me everybody that I should follow up with this week. It'll give you all of those names. Open their profile. You can see, okay, we sent them a referral to this food pantry. Let me check in with this person. I'll call them, I'll email them. However you usually get in touch with them is fine. And you want to ask them, did you go to the program? Did they have what you need? Do you need a different program? Are you not eligible, even though we thought you might be? And all of those different real world scenarios can be captured here in the referral status. So if they were not eligible, or maybe there was no capacity, or they were referred to a different program, you can click that button here. And that way your colleagues can all be on the same page with an understanding of what is actually going on for this person, because the referral is just the first step. You want to make sure that you follow up and get them the care that they need. And hopefully at the end of the day, you can mark this as Got Help, which facilitates a closed loop, meaning there's no more work to do for that particular referral. Maria, the assessment page will show up right after you log into the staff site. So it'll look a little bit like this. It should say Standard Needs Assessment at the top of the page. Good question. The last couple things that I want to quickly talk about, I know we're running short on time here. Just know that over time, if you want to indicate specific programs that are really helpful, that you're constantly referring people to, you can save that program to your own list, right? So just for example, let's say there's a particular food pantry in downtown DC that you're always sending referrals to. How do we make this even faster so that you don't have to keep searching for the same thing? When you're on the program, you click Save, and then you can add it to a folder. So for example, you can create a folder that says DC food pantries, and then save it to that. And then you can find those programs later by clicking on your name and then clicking Saved Favorites. And then that'll show you all of the different favorite folders that you've created for yourself. And if you want to, you can even share that folder with a team member just by opening the folder. I have one here for, this is Jersey City food delivery. You could click that and then click share and then send it, as a link or an email, or just send it to everybody in the group that you're assigned to. So again, we'll do a little bit of configuration on the backside just to make sure that if you're on the case management team, if you're with the community health administration, whatever it is, we can add that in there. And that way you all have shared visibility into those programs. Lastly, there's a couple other buttons that you'll see here on the program page. I'm just going to very briefly go over what these mean. Sharing it will allow you to send an email or text or Facebook link. It is not a referral because you're not actually sending any communication to the program. You're just sharing details about the program with the seeker, right? So it's just another way of saying, hey, here's a phone number if you want to call them directly. So you can share it that way. You can also print program information by clicking print view, which shows up here after you click more info. Notes is pretty self-explanatory. You can just write a couple of comments about a program. It's not shared with the program. It's not like Yelp. It's just for your own records. And then lastly, the suggest button is how you can, if necessary, alert the Find Help team that something needs to be updated here, right? Their office hours are different. Their phone number is different. They're closed on Sundays, whatever it might be. You can just type it in there. It doesn't have to be some complicated thing. You can just say closed on Sundays and that's it. If you send it, we will receive that information and typically update it within 2 to 3 business days, and we'll confirm with you via email once that is completed. All right. I want to open it up to questions. I know we only have a couple minutes left, but the last thing I'll mention before that is our support portal. I'm going to share a link to this as well in the chat. This is a fantastic resource. I cannot stress enough how helpful this is, even for me and some other folks that work at Find Help. If we ever have the occasional question that we want to just, double, triple confirm, you can search how to send referrals. If you want to learn more about analytics, more about the People I'm Helping dashboard, type in any one of those things and you'll find an article with videos, step-by-step instructions, screenshots. This literally has all the information in my head, but it's on a website that you can ask 24/7. It's awesome. So definitely recommend you bookmarking that one. But otherwise, I know we're nearing the end of our hour here, so I would love to open it up to any questions. Because it seems like there's no questions, I'm going to use the last minute just to make one other pitch. It's not a pitch actually, but I want to let you know that there are many organizations in our network that have claimed their resource. So if you see this check mark in the top right-hand side, in fact, you can even hover over it and it'll tell you this program has been claimed. What that means is the organization has affirmed that they, anyone from their team can log in and say, I work here. And we verify that. And then once we can affirm that that's true, we give that individual or multiple individuals the ability to update their own program listing, right? So anyone on the call today, if you work at one of these organizations that provides direct services to the community, I encourage you, if you haven't already, to search for your program. It's probably already in there, but if not, you can also suggest that it be added. But if you find your program, all you'll need to do is click suggest and then click manage this listing, right? It says, do you work here? If you manage this listing, you can unlock it and update it on your own time. So by doing that, you'll just have to follow a very short couple of steps. It'll take you through the process there. And then we'll make sure that you actually work at this organization. And if so, we will give you the ability to change the description, change the office hours, change the address, change the phone number. You'll be able to do all of those things without us having to do it for you. The other upside of a claimed program is that you get your own analytics dashboards and a separate case management tool so that you can track inbound referrals as opposed to referrals that you're sending out to other programs. Does it create a profile for each client? Anytime you send a referral for a client, it will create a profile for them if they don't have one already. That will also happen if you complete the standard needs assessment. Even if you don't send a referral, if you complete this assessment, it'll create a profile for that person. All right, I'm officially past my time, but any other questions? If not, I want to thank you all for letting me crash your meeting today. My door is always open, so I'm going to put my email in the chat as well. If you have questions about it, I would just ask that you first check out the support portal because it's a wealth of information. But if you're not finding an answer there, just reach out to me.
Thank you so much, Ryan. And I think maybe the lack of questions is because I think you all have created a really, I think, clear space to navigate, as once you know what's in there, I think it's pretty straightforward. So thank you for that. And please, like Ryan said, if there's any questions, if you haven't checked the support page, or if you don't find it on the support page, reach out to Ryan. Appreciate your time and appreciate our guest today. If you are part of the Health Literacy Collaborative, please stay on. But if you are not, thank you for sharing this space with us today. And thank you, Ryan, again. And I think we're all looking forward to utilizing this and